In a world marked by growing inequalities and global crises, local governments stand at the front line of action. We face the challenge of building societies grounded in rights and driven by universal public services. The municipal movement is advancing the local social covenant. This is not just a commitment, it is a call to action. Housing is a right, not a privilege. Local governments demand policies that ensure access to adequate, affordable, and dignified housing for all. Culture is the backbone of democracy and social cohesion. We fight for cultural rights as a pillar of human dignity and collective memory. Without strong local finances, there is no local democracy. Fiscal justice and direct access to resources are essential to deliver public services that leave no one behind. The climate emergency is a human rights crisis. We must act locally to ensure a just transition that protects communities, ecosystems, and future generations. Health is a public good, not a commodity. We champion universal, community-based health services to guarantee care for all. Care, digital rights, time, and cities after dark are the new essentials. Cities and territories are reclaiming public services as foundations of democratic societies. Peace is built in our streets, in our neighborhoods, in our communities. Local governments are key actors in conflict prevention and fostering social cohesion. Hunger is a collective failure. We need territorialized food systems that guarantee access to healthy, sustainable, and locally produced food. The local social covenant secures political commitments to guarantee these fundamental rights. We are developing sustainable, concrete solutions that address today's challenges while securing a just future for the next generations. We bring local voices to global tables, ensuring that cities and territories shape international agendas through our diverse and interconnected multilateral strategies. The local social covenant is not just our strategy, it is our political determination. It is a commitment to dignity, justice, and collective action. Together, we are shaping the future through a bold, inclusive, and renewed municipal movement.
Good afternoon, or depending on where you join us from, good morning and good evening. I'm Megan Edwards from the UCLG World Secretariat, and I'm happy to welcome you to the third meeting of the UCLG's Policy Councils, convened around our local social covenant. Today, the focus is on housing, conflict prevention, and public health. Before we begin, I'd just like to remind you that interpretation is available in English, Spanish, and French. And we also encourage you to keep your cameras on so we can all see each other and make this call as interactive as possible. It's my pleasure to hand the floor to Emilia Saiz, UCLG's Secretary General, for some opening remarks. Thank you.
Thank you very much, Megan, and welcome everyone. Thank you for joining these important discussions for our collective agenda. As you know, United Cities and local governments is mandated to develop that collective way forward, a global perspective to local policies, and ensuring to provide content to what we believe is the link between the local and the global perspectives. We build this collective global agenda from your local realities, and of course we are serving local and regional governments but we have always believed in our municipal and territorial movement that this was not a job that could be done alone. No single actor, no single country, no single sphere of government could be meaningful enough to face the challenges and the transformations that we need to make. And so for already, I would say, since our Congress in Durban, we established a structural dialogue with organized civil society, what we call the town halls, and that is a process that we are trying to strengthen, to enhance, and to give even more structure to. This is how the local social covenant has come about. It is part of our preparations towards the next Congress of United Cities and Local Governments that is going to be taking place next June in Tangier. Yes, certainly, but it's more than that. It's actually a platform for deliberations with organized civil society, facilitating the inputs from civil society, but also the exchanges between civil society and elected officials. And I think that part of exchanges, documenting those exchanges and making sure that they are structural, is what is innovative and stronger in this process towards Tangier. The local social covenant does not only provide a set of convictions and determines what our priorities are, but it's actually a process that is trying to advance high-level commitments, actionable solutions, and multilateral strategies. And at a moment in time where we are questioning whether the multilateral system that we know will survive for very long, and where everybody is thinking, well, this is collapsing, and so we don't know who the interlocutor would be, we feel that this alliance of civil society and local elected officials is very critical to shape the future agenda. So that is what we're trying to do here today. This is one of our policy councils with elected officials coming together, following up on the letters that have been exchanged on concrete on the concrete topics that we are going to cover today. The letters are our way to document the exchanges between the elected officials and our partners in civil society. It is the way that we are trying to ensure that there is transparency, that there is ownership from our constituency, but also that will allow us to go a little bit further, to compare positions with positions that we have had before, and to challenge ourselves to innovate and to ask some of the difficult questions that we need to ask ourselves in this environment. I am very happy to say that our World Council, also in these complex times, has confirmed this mandate, has showed trust in the ability of our World Organization to carry forward with complex issues such as human rights, anti-discrimination, etc., and has also allowed us to go deeper into some of the issues that we have dealt with since the outset of the organization, such as peace and conflict prevention, health as well. They have told us, look at what new service provision would look like around those areas. What would be the new roles that we would need to undertake? How do we meet the expectations of our citizens right now, but also those of the future? And we are allowed to do that as a group from the perspective not only of competencies and capacities of local governments, but also from a perspective of ambition and vision, understanding local governments as the protectors of the commons, beyond the providers of local services, and also working on this notion that we were discussing this morning when talking about human rights in another meeting, looking at the perspective that everybody needs to pay attention to, which is duty bearers beyond responsibilities or competencies. So it's a very rich mandate. We feel very fortunate because the discussions that are being held internationally are not that encouraging. But I am certain that in this group we will have very interesting perspective and the way that we would like to handle this meeting is be as frank as possible. Please do tell us what you are missing in the letters, what you are concerned about. It is your priorities, mainly those of elected officials, that we need to hear from, and obviously also from our partners playing a very key role in the different exchanges. So thank you very much to all of you here, in particular our political leaders joining us today. And with that, I would say my job for now is done. I will join you later for the debate. Thank you.
Thank you very much, Emilia. And so we will turn now to the presentation of the key messages and the key priorities highlighted in the first letters of the social covenant on the three pillars that are in focus today. So this is public health, housing, and conflict prevention. And as you've mentioned, this is a structured written exchange between our UCLG policy councils and the UCLG town hall with organized civil society and partners. And this is a process of joint envisioning that we have wanted to facilitate in a way that is very much alive and reciprocal. So it goes in both ways. On certain pillars of the local social covenant, the first letter is written by partners from academia and civil society. And this is, for instance, the case for the letters on housing and conflict prevention. When for other letters, such as the letter on public health, it is led by policy counselors and addressed to key partners. And so I want to start precisely with this letter on public health, which has been led by the mayor of Banjul and the mayor of Daejeon, who is a member of the UCLG executive presidency. And today I'd like to introduce the mayor of Banjul, Mrs. Rohi Malik Low. You're also the president of Refela, the network of locally elected women across Africa, as well as the co-chair of the UCLG Policy Council on the right to the city and reclaiming the commons. And you're also a member of the UCLG Standing Committee on Gender Equality, among many other roles. So thank you very much for being with us today. And the floor is yours to present the main political messages of this letter on public health as a basis for the discussion that will follow.
Thank you very much. Dear colleagues, it is a pleasure to share with you today the main messages of the letter on public health as its co-signatory, together with the mayor of Daejeon. This letter is a collective call to place health and care at the center of our vision for the local social covenant. In our cities and territories, we are advancing a profound transformation in how health is understood and governed. For local and regional governments, health is not limited to healthcare services. Health is political, territorial, and deeply connected to justice, democracy, and indeed equality. In our daily responsibility as mayors, we see how the right to health is inseparable from the right to the city and from universal access to local public services. We stand firmly in defense of universal and public local care systems. Health cannot be reduced to a community. Through this letter, dear colleagues, we reaffirm our political commitment to build territorial, territories that heal both people and the planet. Local and regional governments are working to strengthen health systems that treat health as a common good and a fundamental human right. This means integrating prevention, accessibility, and solidarity across all areas of local governance, from community health and local care systems to environmental protection. Equally important is our commitment to democratic health governance. Communities, caregivers, and local public institutions must be part of shaping health policies. We firmly believe that health cannot be built without democracy, and democracy cannot be sustained without care. Today, together with my dear colleague, the Mayor of Daejeon, and with you all as policy councillors, we are putting forward a clear call to action to the World Health Organization and to the international community. We call for stronger recognition of the essential role that local and regional governments play in addressing the social, environmental, and economic determinants of health. We call for the systematic integration of local and regional perspectives into global health frameworks. Dear colleagues, we call again for targeted investment in local capacities, including data, innovation, partnerships, and integrated public health strategies, so that territories can lead evidence-based transformation. We stand ready to deepen our collaboration with the World Health Organization to reclaim health as a common good for both present and future generations. Dear colleagues, achieving health for all will only be possible if it is built from the territories, with the people, and through shared responsibility. On that note, I thank you all.
Thank you very much, Mayor, for sharing these messages from this letter from you and from the president of UCLG. And in particular, thank you for highlighting that health cannot be built without democracy, and that in turn, democracy cannot be sustained in time without care. I also wanted to mention that this letter opens different questions and it ends different question for all of us to reflect in the conversation that will follow on how to co-create local care systems that are empowering, on how to reclaim health as a common, and on how to mobilize multi-stakeholder engagement. So we will later introduce our colleagues joining us from the World Health Organization for a first reaction to this letter, and have many other reactions just later. For now, I'd like to move to the second letter that we will be discussing today, which is the letter on housing. And it is signed by the Housing Justice Team at the International Institute for Environment and Development, or IID. And it will be presented by Camila Cosigna, who is senior researcher at this Housing Justice Team. Camila, thank you very much for sharing with our policy councils this letter, a very ambitious letter, and over to you. Thank you.
Thank you very much, Cecile and Emilia and everybody who is here today. It's really a pleasure for me to be presenting the content of this letter that is really the product of a collective ongoing conversation that from research organizations, civil society organizations, we have been trying to mobilize to advance this idea of housing justice. And I'm reading this letter as a researcher, but also as a human, as a person in our daily work. Year after year, we keep seeing people organizations, communities, groups of people who are facing housing more as a battlefield rather than as a home. We know that some people are facing different forms of threats of evictions. They are facing more and more increased risks related to climate change, people who are day-to-day struggling to pay rents, who are displaced to the margins of the city because of process of speculation, people who are discriminated against because of their sexual orientation, because of their beliefs. And each of those persons have shown us throughout our work that it's at home where people experience most of the crisis that the world is living through. The sad thing is that we know that these stories are not exceptional. These are not abstract. They are really the everyday experience of many people. And we believe that it's your duty as local and regional governments, as local authorities, as those who are at the front line of the everyday experience of your communities, to do everything in your power to stop these housing rights violations. As much as homes are a private space, they are also experiencing a crisis that is sustained by unfair and discriminatory systems. And I think the questions of the commons that was just presented is key for that. We know that some local authorities are doing a lot. We know that a lot of the innovation related to housing is happening at the local level, but we know also that it's not enough. We know that what we need to do to change housing conditions is not just implementing small projects, but we need to change things from the roots. We know that in order to really change the trajectories of housing injustices, we need to change housing systems. And we believe that this systemic change can only happen through a strong commitment to advance housing justice that needs the collaboration between local authorities, civil society organizations, the private sector, universities, and everybody who has a say in housing. And we have identified this kind of 4 asks and calls for action for local and regional governments that we believe are crucial. The first one is about promoting housing that tackles discrimination. We need to stop evictions. That's the first and the very, very minimum line. But there is also many other forms of discrimination that happen in the housing systems that local authorities have the power and the competencies to stop. We need to fight for housing that are radically democratic, that are really thought through processes that involve people and that allow more collective and more collaborative ways of housing production. We need to think of housing as an infrastructure for more caring, for more sustainable and for fairer cities. We know that when we build housing, we build so much more than housing. We build neighborhoods, we build infrastructure, we build the way in which the cities grow. And we need to think of housing in ways that really provide that care fabric for future generations. And finally, we need to think about housing in ways that unlocks more sustainable, more open, and more diverse futures. We need to think that housing is something that doesn't only happen in the Ministry of Housing in a single office in a central government. It happens in the everyday actions that communities take, but also in the ways in which they interact with you, local governments. We know that these are ambitious agendas and cannot be taken lightly. It's a colossal task, but we need to bring others on board to work on this. And just to finish, I think that changing this unjust housing system requires acting together. And we know that the moment local governments decide to act in this direction, there is a whole universe of civil society organization, grassroots groups that are really ready to work together with you. Thank you very much.
Thank you so much, Camila, and thank you for sharing in this letter the directions that we can concretely take, right? Where housing is not just like one of the priorities, but actually a way for us to better understand its role as a lever for change to then achieve other dimensions that are very urgent today. And it's very, very valuable for us and for local and regional governments to define their own contribution to these policy and debates and priorities from the perspective of grassroots organizations and movements that you've mentioned on housing, which are really guiding the way on and increasingly maybe organized on different axes around shifting the focus that has been so far on market access to collective governance and this question of democracy that you've mentioned, from also property per se to more relational understanding of or more relation to land and also to care infrastructure. So thank you for this, and we'll discuss it more in depth later. And for now, the third letter that we will see today is on conflict prevention, and it will be presented by Luisa Portugal, who is Program Officer at Peace in Our Cities. And Luisa, welcome, and over to you.
Thank you so much. Yes, my name is Luisa Portugal. As mentioned, I'm part of the Peace in Our Cities Secretariat. Peace in Our Cities is a network of around 30 cities around the world and a dozen of organizational partners that are all committed to reducing violence in their communities. It's a pleasure to be here with you today, and we thank UCLG for inviting us to pen the letter on violence and conflict prevention. I want to start by saying that violence is broader than conflict. The majority of violence is not happening in conflict zones. It's happening in our cities, our homes, and our streets. And city leaders have a crucial role to play in building a safer world for all. While it might seem like the world's not making any progress towards the SDG 16.1 targets, when looking at the global or national level, this simply isn't true when we look at the city level. Many of our cities have obtained impressive results, being able to reduce homicides and violent crimes by upwards of 80% in the last 10 or 5 years or so. Furthermore, while a lot of the discourse around public safety tries to paint a false dichotomy between a heavy-handed repressive approach that can reduce crime and a lenient approach that is completely ineffective to reduce crime and violence, this couldn't be farther from the truth. Our cities have made remarkable progress on reducing violence and crime in their communities while respecting human rights, democratic values, and taking a human-centered approach to prevention. Effective prevention strategies have 5 common characteristics. They have a balance between service provision and law enforcement. They are evidence-based and data-informed and seek to understand the root causes of violence and conflict. They are legitimate, meaning both in terms of respecting the laws and human rights, but also in having the buy-in of the population. And they are interrelated, designed as a whole of government and whole of society matter that needs to be interconnected. Finally, they are also focused. They understand that violence is a hyper-localized phenomenon, and they concentrate the efforts and resources towards the areas and people that are most at risk of experiencing violence. With that, I'll conclude by reassuring local leaders that you can make real change to prevent and reduce violence and build a safer world city by city. And we encourage you to do so by prioritizing preventative action over repressive action, adopting human-centered and data-informed solutions, ensuring that your actions are legitimate and have the buy-in of the population, coordinating preventative action across sectors, levels of government, developing strategies that recognize the hyper-localized and interrelated nature of violence and focus on those most at risk. With that, I thank you for listening. I'm glad to be here, ready to answer any questions, and I appreciate everyone's commitment to build a safer world for all.
Thank you so much, and thank you for in particular for the way this letter and your presentation just now very much expand, but also deepen at the same time the understanding that we need to have around peace, around conflict prevention, around all the work around the different forms violence takes today and in the future. So I think this is very much something that we need to also discuss in terms of what can be then the response from local and regional governments to these priorities that you've mentioned. And now, with all these things that we want to discuss together, I will hand it back to Emilia, who will facilitate the open discussion around all the 3 letters at the same time. And thank you all.
Thank you very much, Cecile, and thank you for the presenters of the letters. Well, to the Mayor of Banjul, what can I say? It is such a privilege to be able to work with you and to see this kind of commitment also with our President, the Mayor of Daillon, and to Camila, of course, and Luisa. Well, thank you for that wonderful commitment. Since we we have heard from our partners. I want to make sure that we also get a reaction to the letter on health from the perspective of one of our most critical partners in this area, from the World Health Organization. I mean, everybody knows that the COVID really marked our movement. What we went through the pandemic really marked how we experienced the process of the development of the Pact for the Future, and it actually inspired our Pact for the Future of Humanity, which is still very much the backbone and the commitments of what we are now trying to deepen into and to have reflected in the outcome documents of the Tangier Congress. Health is something that we have been trying to have addressed by our membership much beyond healthcare, while also pushing for universal healthcare as municipal movement over the past years. So I am very happy to have you with us, Natalie Rubel, head of the Urban Health Unit of the World Health Organization. Thank you for taking the challenge to follow these discussions. Your initial reactions to our letter are very welcome at this point.
Thank you very much, Emilia, and a very big thanks for having us here, and honorable mayors, excellencies, and dear colleagues. Thank you for giving WHO the floor to react to this extremely important letter that was sent by the mayor of Daejeon and Banjul on that call that is really putting the right to health and dignity at the forefront. First of all, I would like, with my statement, to acknowledge the receipt of the letter and to confirm that it's under review by our Director General's office. And actually, I would like to take the opportunity to express our apologies for being pretty late in the reply. As you all know, WHO has been experiencing one of the most difficult years in its history last year, certainly something that many of our colleagues in other multilateral organizations have faced. And this has resulted in major financial crisis and has actually severely impacted our human resources and overall budget. And I'm saying this because it's important for the positioning of the agenda. In headquarters alone and in other major offices in the regions, we have gone through major human resources cuts, actually up to 30 to 40%. And this has actually led to a restructuring of the organization that has resulted also in having to prioritize some areas versus others. And as you can imagine, this has been taking quite a lot of time by senior management. And as we speak, right today, we have the executive board where WHO is reporting back to the results of these changes to our member states and discussing actually the impact and the consequences. So all this is to mention that the importance of the topic, but also explaining some of the reasons why there is delayed official response to the letter, and please accept apologies. Now, this being said, I think it's important that we look at the positive and the promising developments. I think first of all is that while there have been all these changes, the work that WHO is doing and leading on urban health and the objective that WHO has to support the organization in providing support to member states to strengthen urban governance is maintained. And I think in the current environment, this is a major achievement, and it's also a political, very strong signal. The organizational restructuring, actually, and it's the other way around, has actually allowed to more strongly bring together and more coherently a lot of the different technical teams that WHO is having and that are focusing on city urban work. So they work on urban health, healthy cities, H1D cities, and communities. So all this is showing that in a moment where actually that we have been under restrictions and constraints, the work on urban, on cities have been maintained. And if you look at WHO's overall global program of work 14, where we highlight the importance of acting on social, environmental, and economic determinants in order to address equity, it clearly acknowledges the role that local governments and cities actually play to achieve global health. So in this moment of challenges, in this moment of changes, both in terms of the structure, the finance, and the program, the work on urban, the work on cities, the role that cities play to achieve global health is maintained, is strengthened. And so maybe I just would like to focus on a couple of issues and a couple of areas where WHO has been working that is really related to the letter that was received by the honorable mayors. First of all, and Emilia, you just mentioned it, you mentioned COVID. And in fact, the after COVID has showed more strongly that if we want to be efficient in emergency preparedness and response globally, this needs to go through cities. And some of you may know that after COVID, WHO has been working on developing specific guidance for national and local authorities in strengthening their emergency preparedness in cities and the response. The second is that I was just, that was mentioned in the letter, was the need of investing in strengthening local capacities to work intersectorally for health outcomes. And this is something that WHO very strongly emphasizes. We really put the need of providing support to local practitioners to have those capacities to be working in an intersectoral manner for achieving health outcomes. So this is really at the core of our work. The third point I would like to make is the need of global health frameworks through activities and through strengthening the role that local government plays. And again, WHO last year has been launching the strategic approach to urban health, which actually puts exactly this in the forefront. It says that if you want to achieve global health, this needs to go through a very strategic approach at the very urban level. And that strategic approach looks at health, but it interlinks actually the major societal developments that are happening at the very local scale and to use them for a better health outcome. And the last example that I want to mention is that we were talking about data. This was mentioned in the letter. And this is absolutely true, and this is absolutely important. It is important to have local data, to empower the collection and the use and the analysis of that data. And in the past, a lot of the work, and I'm using just one example, on non-communicable diseases and injuries, for example, was done at a national scale. And very recently, there has been a scaled support to cities by having standardized monitoring frameworks that actually measure progress on addressing NCDs and injuries at the very city level. So all this to give you some example about how actually the shift is happening within our own organization and understanding and underlying the importance of working with and for local governments. And one cross-cutting issue across all these examples is absolutely the need of doing this in close collaboration with their communities. So the community engagement, and I mean community engagement at different levels, is absolutely crucial. So we are very much putting the development of an urban governance framework that really builds on multi-sectorial urban governance that relies on strong community involvement at the very local level. So this is just to reflect on some of the elements that the letter puts forward. It emphasizes the importance that this agenda has for WHO. And it's very important to have feedback from our honorable mayors and all the colleagues around this table and beyond on what should be strengthened further. And if I can just close by one thing, just making the link between the different agendas, we had the second presentation on housing. Housing is a key determinant of health. And so there is the importance of seeing those different agendas very strongly interlinked. Housing is an environmental, economic, and social determinant. We cannot address health without addressing the housing sector. So therefore, in this agenda on health, there is a special place, if I would say, for housing as a key sector. With this, Emilia, I give back the floor to you, and I'm very much looking forward to feedback from the colleagues attending the meeting. Over to you.
Well, thank you very much. And this last point that you have made on the links between the different parts of the agenda is one of the challenges that we are facing all the time when we look at that new generation of service provision on how we can translate our commitments and our visions of the Pact for the Future of Humanity into the concrete policy and actions at local, regional, and global level. Those links between agendas become very, very important. But also when you look at the definition of the new essentials as well. And health is one of these spaces where, in addition to the links with the different parts of the agenda, like housing or conflict prevention, for that matter, where we find that fine line between the private and the public playing a very strong role. And Camila was saying something like that. Housing seems very private, health also, right? Because it is something that is experienced as individual, but at the end of the day, a reality is that we need to consider health also as a collective agenda, and that tension, respecting privacy while dealing with health from this collective perspective is the kind of shift that we want to introduce as well in the perspective that our members need to take into account when developing policy. So thank you very much for those inputs. All of you, and we are now going to start listening to some of the political leaders that have joined us today. I want to also acknowledge some of the other partners that are with us and our Ubuntu advisors, both Billy Cobbett and Maria Fernanda Espinosa, also joining. Please feel free to raise your hands after you have listened to some of our elected officials, if you so wish, because we are looking at you as well to develop this agenda and to have a very robust outcome document in Tangier. I am so pleased to have with us Ana Lucía Reis, la alcaldesa de Cobija, la presidenta de la Asociación Boliviana de Municipios y nuestra copresidenta en la presidencia de CGLU. Es un gusto volverte a ver, ya hacía un tiempito. Ana Lucía, qué gusto verte bien. Muchísimas gracias por estar con nosotros y a ti la palabra.
Muchas gracias, Emilia. Qué gusto verte, aunque sea por pantalla, ¿no? Pero siempre un placer, gracias por todo y un saludo también a todos los que nos acompañan en este momento desde la Amazonía boliviana, ¿no? Bueno, y hablar sobre justamente el tema, sobre los principios planteados y decirles que sí, nosotros estamos de acuerdo. Bueno, la salud pues es un bien público, es un derecho humano fundamental, ¿no? Y de los gobiernos municipales sostenemos que la salud no puede tratarse como un privilegio, ¿no? Ni como una mercancía, pues, sino como un derecho garantizado por el Estado y en todos sus niveles. Y esto también con un enfoque realmente de dignidad humana, de una justicia social, es lo que realmente necesitamos. Y en muchos municipios, principalmente en el caso de Bolivia, el caso de salud ahorita no está siendo tomado en cuenta como la prioridad por la falta de recursos, ¿no? Ahora también decirles que el acceso equitativo a nuestra atención sanitaria es la cobertura universal y es el fortalecimiento de la atención primaria y preventiva, son muy esenciales. También coincidimos plenamente en que la sociedad más saludable se construye desde la prevención, la atención primaria fuerte, nuestros centros de salud que atienden el 60% de los casos, ¿no? Entonces, la atención primaria tiene que ser siempre muy bien reforzada, que es lo que está más cercana al territorio y culturalmente pertinente, ¿no? La equidad territorial, especialmente para las áreas rurales, también las periurbanas, y siempre es una prioridad municipal. La salud tiene que redefinirse democráticamente desde la base. Creemos también firmemente en una salud pública construida con la participación de las comunidades. Todos tienen que estar realmente involucrados, ¿no? Entonces, todas las que son las personas, ciudadanos, las organizaciones sociales, todos los actores locales, y siempre tenemos que priorizar la prevención y el acceso oportuno, y también muy importante es la solidaridad que tiene que estar de la mano con la salud. Sobre los compromisos solicitados, sí nos comprometemos a ello, forjar un nuevo contrato social para la salud basado en el ciudadano, la equidad, la responsabilidad compartida entre el Estado, los gobiernos subnacionales y la ciudadanía, ¿no? Donde nadie puede quedar excluido por razones económicas, que es lo que se sufre ahora, geográficas o sociales. También importantísimo abogar por el fortalecimiento del rol de los gobiernos locales en la gestión de los determinantes sociales. Realmente importante lo que es los gobiernos locales, el involucramiento, el estar siempre de manos dadas, ¿no? Con lo social, lo ambiental y lo económico de la salud. Esto es importantísimo. Y reconociendo también que factores como el agua, el saneamiento, el medio ambiente, la vivienda, la alimentación y el empleo digno son competencias donde los municipios cumplen un papel decisivo, pero que tampoco están logrando muchos municipios y varios países debido a la situación económica, ¿no? Entonces, integrar las voces locales en la gobernanza de la salud, tanto a nivel nacional como en espacios regionales y globales, para tener mucho más fuerza, que nuestra voz realmente sea más poderosa, y participando activamente en el diseño de la política pública, la toma de decisiones y los mecanismos de seguimiento y evaluación, que son importantes. Desde la Amazonía boliviana tenemos ejemplos claros que refuerzan estos principios y compromisos. En el caso de nosotros, la capital de la Amazonía boliviana, que es Cobija, capital del departamento Pando, la salud pública enfrenta desafíos particulares, como ya lo venía diciendo al inicio, asociada al territorio amazónico, a la alta humedad, enfermedades tropicales como dengue, la malaria, la leishmaniasis, ¿no? Dificultades de acceso en época de lluvia, y también una población fronteriza y altamente móvil, principalmente ahora esta época de la castaña. Un ejemplo concreto es el rol del gobierno municipal en la prevención y atención primaria, a través de brigadas de salud comunitaria que trabajan directamente en barrios perurbanos y también en las comunidades cercanas, enfocándonos en prevención del dengue, eliminación de todo lo que son los criaderos, educación sanitaria, ¿no? Casa por casa, se va haciendo la visita, y también la coordinación con nuestros centros de salud, en realidad, que son un ejemplo en la salud, de la cuestión de los centros dentro del área urbana, porque están siempre muy bien equipados, que la mayor parte de los problemas visitan a los centros de salud, ¿no? Entonces, estas acciones lideradas desde el municipio y con participación comunitaria han demostrado que la prevención local y cómo salvar vidas y reducir la presión sobre el sistema hospitalario, porque en general por cualquier dolor normalmente se van hasta el hospital y es lo que nos llena el hospital y no damos atención a lo importante que son las emergencias. Esto sería, Emilia querida, y a todos los que nos escuchan en este momento, muchísimas gracias. Desde la Amazonía un abrazo para todos y que sea exitoso todo el trabajo que se viene realizando hasta este momento. Felicidades nuevamente, Emilia querida. Muchas gracias.
Muchísimas gracias, copresidenta, verdaderamente por regalarnos esta visión que está llena de pragmatismo, de visión y experiencia local, pero que también tiene mucho que ver con una gran capacidad de visionar futuro, ¿no? Y de enlazar lo local y lo global. O sea que muchísimas gracias por traer esto a la discusión. Yo quisiera destacar dos cosas porque hay tantas que nos has dejado, pero yo la cuestión de la gestión de esos determinantes sociales creo que enlaza muy bien al conectar con vivienda, al conectar con el cambio climático. O sea, yo creo que esto tiene que ser algo en lo que profundicemos. Y después el tema de territorialidad, seguridad, creo que también es extremadamente importante. Y que hay aquí un papel, a mí siempre me cuesta un poco pensar solamente en salud desde la perspectiva urbana, creo que nosotros vamos un poco más lejos, que es verdaderamente desde los gobiernos locales y territoriales. Y desde esa capitalidad de esa región amazónica, pues nos has traído esa perspectiva que nos ayuda mucho. Muchas gracias, copresidenta. Pues ahora vamos, let me go to the president of the Rwandan Association of Local Government Authorities, RALGA, Ms. Odette Uwisige. I was saying your title first because I knew I was going to butcher your name, your beautiful name. Odette, I'm really happy to have you with us as president of RALGA. Please, your perspective on, I think, is going to be conflict prevention. Welcome, madam.
Thank you so much. I'm Dr. Odette Uwisige. I'm the chairperson of Rwanda Association of Local Government Associations. And I'm also the chairperson of Rusizi District Council and chairperson of Commonwealth Women in Local Government Network. So it's my pleasure to be with you today to share the best experiences in Rwanda on conflict prevention. And Rwanda utilizes a mix of community-based and institutional strategies for conflict prevention, and the various factors have influenced the success in the implementation of peace-building efforts. In addition to active participation of our citizens, we also work with various stakeholders, such as civil society, faith-based organizations, local NGOs, international partners, Rwanda Government Board, Joint Action Development Forum, and other local stakeholders. So Rwanda has the best homegrown initiatives that are productive and tailored to the challenges of its citizen. And here I can just mention community assemblies that provide the citizens with advice on sustainable development, share with the government national strategies, priorities, policies, and most importantly, examine and solve citizens' concerns at a village level. We also have community work that provide a kind of contribution on socio-economic development, and that community work assists us to work on infrastructure development, environmental protection, and cleanliness. So second, through meetings that we do conduct after the community work, these provide and contribute to information sharing on the implementation of the government programs and fostering social cohesion and peace building within our community. We also have the National Dialogue Council that is annually chaired by His Excellency, the President of the Republic of Rwanda, and it acts as a premier accountability forum. And this is indeed a fundamental Rwandan homegrown solution rooted in the Rwandan Constitution, where citizens directly engage with leaders to evaluate the state of the nation, foster unity, and drive development. So the key roles of the National Dialogue Council, first of all, we have that national dialogue, and we do have accountability of leaders. So this provides a platform for citizens to question leaders, discuss development programs, and hold the government officials accountable, and fostering transparency governance. The second role is on policy evaluation and formulation, whereby participants review the progress of national strategies and set priorities for the country's development agenda. The third one is on unity and reconciliation, and this strengthens national cohesion by bringing together diverse representatives from all the local government levels from the representatives of the villages, cell districts, central and local government, senior officials, diaspora, civil society, private sector, media, and this allows in-person and digital participation, ensuring inclusive dialogue for all Rwandans in various sites within the country. So the first role is on decision-making, whereby the forum produces actionable resolutions to address key issues on governance, economic resilience, and social welfare. So importantly, the implementation of the resolutions of the last year's gathering is evaluated at the start of the following year's National Dialogue Council. We also have local mediation committees, whereby these are locally elected members, mediators, mandated to resolve civil and small-scale criminal disputes, aiming for mutually acceptable solutions to prevent escalating conflict, thereby promoting local peace. We also have alternative dispute resolutions policy aimed at empowering citizens to resolve disputes without resorting to the litigation process. So we do reinforce social cohesion and prevent conflict in that way. So the following, the other one is on citizen participation in socio-economic
30 seconds more, madam.
So whereby you have performance contracts, which are set at district level. And among these, we do have a participatory approach in housing. We've been talking about housing, whereby citizens provide land, and the government and other partners help to build housing, collective housing, so that vulnerable citizens can use those houses to have a better life, a better way of living in the society.
Thank you very much. Thank you for sharing with us this extensive set of.
So we can mention many aimed by this. Thank you so much.
Thank you, madam. You were cut off there, so I didn't mean to interrupt you, but thank you so much for wrapping up. I know it is very difficult to share so many experiences and so much know-how in a few minutes, but what we keep, I think, as a group today is a clear commitment with prevention through dialogue, and that integration of the different topics is. So it's not dealing with security alone. You cannot deal with security alone if you don't deal with other basic needs. Obviously, you do need to work on unity, ownership of policies, etc. But certainly the sense of agency that local governments need to give to citizens is very much part and parcel of conflict prevention and the sustainability of peace, if you allow me to put it that way. So thank you very much from this example and views from Rwanda. And we are now going back to Latin America with the prefect of Manabí. Prefecto, por favor, es un gusto tenerle con nosotras hoy. Bienvenido, como siempre. Adelante con sus reflexiones sobre las temáticas que tenemos hoy sobre la mesa. Leonardo Orlando, prefecto de Manabí. Un gusto verte.
Muchas gracias, apreciada Emilia. Un saludo a todos los representantes de los distintos organismos y de gobiernos subnacionales que hoy, a través de este Consejo Político de Ciudades y Gobiernos Locales Unidos sobre prevención de conflictos, vivienda y salud pública, podemos intercambiar un saludo a nuestra compatriota también, María Fernanda Espinosa. Es un gusto comentarles desde Manabí cómo hemos abrazado la seguridad humana con un sello territorial. Hemos seguido lineamientos metodológicos del Programa de Naciones Unidas para el Desarrollo y abordado la seguridad desde sus 7 dimensiones, no solo la seguridad física, comunitaria, sino mucho más integral, la seguridad ambiental, la seguridad económica, la seguridad alimentaria y también la seguridad política e institucional. Coincidimos plenamente con la Carta de la Coalición Social Local, que la paz no es simplemente ausencia de conflictos, sino también, sobre todo, la presencia de justicia social, libertad, la dignidad de los derechos humanos frente al miedo, la opresión, la miseria y la exclusión. En Manabí siempre el ser humano será el principio y fin de todas nuestras políticas públicas y nos alineamos plenamente a ese lema de la Agenda Global 2030, en donde nadie, ningún ser humano, por ninguna causa, se debe quedar atrás de ese derecho fundamental al desarrollo, a la paz, a la prosperidad y el progreso. Desde nuestra gestión en el territorio respondemos con un rotundo sí a las premisas planteadas, pues nuestras acciones ya demuestran que la prevención, la sensibilización, la concienciación y la articulación con una gobernanza multinivel es el camino. Respecto de la amplitud del conflicto, entendemos que la inestabilidad nace de la falta de oportunidades, de las desigualdades, de las injusticias. Por ello abordamos la prevención desde la formación ética de nuestra niñez, adolescencia y juventud, a través, por ejemplo, del deporte y del arte y la cultura. Llegamos con 18.000 niñas, niños y adolescentes en un proyecto emblemático que hemos denominado Entrenando Valores, donde no solo enseñamos las prácticas del deporte más popular del mundo, como es el fútbol, sino que abordamos las charlas y la educación en valores y también la prevención en la salud de los beneficiarios de este programa. También con más de 2.000 beneficiarios, se aproximan a 3.000 beneficiarios de escuelas de arte y de cultura, para que a través de la música, la pintura, la danza, el teatro, nuestra niñez, adolescencia y juventud tenga oportunidades de aprovechamiento positivo del tiempo libre y prevenir, obviamente, de los riesgos sociales, del consumo temprano de alcohol, de drogas y del reclutamiento criminal que ya no solo pasa por los jóvenes, sino también por adolescentes e incluso niños. Fortaleciendo el tejido social desde la responsabilidad compartida, desde la disciplina, desde los principios y valores. Asimismo, reconocemos que no hay paz sin hogares seguros. Hemos pasado de la asistencia a una política pública de protección integral para mujeres, para adolescentes y niños en condición de abandono, para grupos LGTBI+, que también sufren mucha violencia, exclusión y desigualdades, eliminando el miedo doméstico y cotidiano a través de una red de centros de atención y de acogimiento institucional para mujeres y menores de edad víctimas de violencia y de los más graves abusos psicológicos e incluso sexual. Sobre la violencia no letal, la exclusión es una violencia silenciosa. En Manabí hemos desconcentrado el servicio de salud en prevención y atención primaria con cerca ya de 70 centros de rehabilitación física que no solo curan las dolencias del cuerpo, sino también del espíritu, del alma, y que a través de sanar la dignidad, de mejorar la autoestima, de devolver la autonomía y movilidad a quienes antes estaban postrados en una cama, en una silla de ruedas, para nosotros es un acto esencial de paz, de amor, de inclusión. Sobre los factores estructurales, la paz se siembra en el campo para evitar que las crisis económicas y alimentarias estallen en las ciudades. Combatimos la desigualdad estructural, económica y social con 217 escuelas del productor, cerca de 8.000 agricultores, ganaderos, pescadores artesanales, a los cuales se suman hoy las escuelas de formación en gastronomía, hoy que Manabí es región mundial de la gastronomía 2026, y aprovechamos a hacer una invitación a todos a el encuentro, la segunda cumbre mundial de gastronomía que será en Manabí en octubre del presente año 2026. para fortalecer la seguridad y soberanía alimentaria, para agregar valor a nuestros productos primarios y con un enfoque siempre de equidad de género e intergeneracional. Evitamos también la migración forzosa y la marginalidad rural y urbana, periurbana, asegurando igualdad de oportunidades y prosperidad y precios justos para nuestros pequeños y medianos productores agroalimentarios. Desde el compromiso, solemnemente ratificamos nuestra firme voluntad y nos comprometemos a priorizar la prevención sobre la represión, invirtiendo en seguridad blanda, demostrando que un gobierno intermedio puede liderar la paz mediante la inversión social y la economía y la política del cuidado. Enfoque en las personas y datos para tomar decisiones seguras e inteligentes. Mantener nuestra metodología de diagnóstico y de evaluación y de prospectiva a través del Observatorio de Desarrollo Sostenible y de Seguridad Humana, con una cartografía social para actuar con precisión técnica, rigurosidad académica y científica en cada comunidad, parroquia, cantón y en general en la provincia.
30 segundos más, prefecto.
La coordinación multisectorial, seguir articulando a la academia, municipios, los demás niveles de gobierno y la sociedad civil bajo nuestro proyecto que es el Pacto por la Vida, para que ninguna acción por la paz sea aislada. Cuenten con Manabí para que en Tánger 2026 la voz de los territorios sea el motor de este nuevo contrato social global. Un abrazo para todos.
Muchísimas gracias, prefecto, no solo por traernos estas convicciones y prácticas desde su tierra en Ecuador, sino también porque nos es muy útil desde donde estamos, desde donde yo me siento, la Secretaría, recibir mandatos tan comprometidos y tan claros. Cuando oímos tan claramente estos compromisos y esa luz verde para que sigamos trabajando en esa dirección, pues nos ayuda mucho, porque necesitamos claridad, necesitamos ser valientes como lo está haciendo usted, y le agradezco en particular que haya traído la cuestión de seguridad alimentaria, que hemos tratado también en otras partes de la discusión, pero que creo que es muy relevante para las temáticas que estamos tratando hoy, con lo que lo tendremos en cuenta, y también la cuestión de migraciones, que es extremadamente importante, también porque muchas veces se problematiza, pero también la vemos como una gran oportunidad, pero no podemos cerrar los ojos a que hay conflictos que afectan mucho las realidades locales y la movilidad de las personas, ¿no? Entonces, muchas gracias por traer esto hoy también a la discusión. And allow me now to go to Europe, to Linda Fortman from the city of Utrecht. She is our co-president for the Committee on Social Inclusion and Participatory Democracy, one of our champions around human rights, that's for sure. So we really look forward to hearing from you, your reflections on these different agendas, but I guess you are going to be starting with housing, if I have it right, Linda. So welcome. It's a pleasure to see you again.
Well, thank you very much, Emilia, for your kind introduction, and good afternoon, colleagues. And it is a pleasure to join this Policy Council meeting, bringing together the themes of conflict prevention, housing and public health, three areas that clearly show how local action is at the front line of today's global challenges. And I would like to briefly share some reflections from my Utrecht perspective, and also in my role as co-president of the UCLG Committee on Social Inclusion, Participatory Democracy and Human Rights. And in Utrecht, we see housing not merely as a policy domain, but as a human right that guides our principal decisions. And that is why we deliberately invest more in people who cannot find a suitable home without support. We link housing to dignity, safety, and equal opportunities so that everyone in our city has a place to come home to. And we actively address discrimination in the housing market, because access to housing should never depend on the origin, on income or background. And we also recognize cultural forms of living, such as the Woonwagen tradition, as a full expression of identity and rights. Participation is central to our approach. Residents do not just give input, they help shape the policy itself. And in this way, we try to build trust in democracy. And in this context, I would also like to draw attention to the new Global Charter Agenda for Human Rights in the City, which I know may still be unfamiliar to some of you here and some partners around this table. The Charter Agenda is both a political document and a collective process, led by cities and local governments. And it aims to place human rights at the center of local policies and at the global agenda of cities. And it does not describe a one-size-fits-all model. Instead, it provides a shared framework that enables local governments to build an integrated approach. By applying a human rights lens, sectoral policies such as housing, public health, and conflict prevention can be connected and mutually reinforcing. And the new Charter Agenda supports cities in translating the principles of participation, inclusion, and accountability into concrete policy responses, strengthening local trust in democracy. The Charter reflects more than 2 decades of our human rights cities movement. And in our cities, we aim to advance this international framework, to recognize it and to act upon it. At the same time, drawing on the experiences of many cities, we have identified new human rights that have emerged from everyday practice. And we seek the adoption of this agenda charter by the municipalist movement as a shared response to today's global challenges. It's important to say that the agenda charter is also linked to a broader political mobilization. The global campaign, 100,000 cities of territories of human rights. And this campaign provides a concrete way for cities to demonstrate leadership, share experiences, and collectively defend the role of local governments as key actors in protecting rights and preventing crises. And as co-president of the committee, I see this moment as an opportunity to bridge policy discussions with political commitment. The letters and documents linked to housing, conflict prevention, and public health show that we already have strong foundations. And the Agenda Charter helps us to connect these efforts into a coherent, rights-based vision for the future of our cities. In closing, I would encourage colleagues to see the Agenda Charter and the Global Campaign not as additional processes, but as tools to strengthen what we are already doing, to align our policies, reinforce the democratic legitimacy, and ensure that human rights remain a guiding principle of local action. Thank you very much, and I look forward to the discussion.
Nou, dankjewel. Ik ben zo blij. You cannot imagine how happy you have made me, because what I am trying to do, what we are trying to do with the team here at the Secretariat and under your leadership, is to actually connect these instruments that we are developing. And we have had discussions on how to do that. And looking at the Charter Agenda and the new human rights that are being identified there, I could clearly see connections with the new essentials that we're trying to promote under this exercise, and the outcome document of Tangier certainly needs to reflect that. So we really take this as homework. These are not additions. These are not things that we put one after the other and that we adopt independently. We need to make sure that this is very, very well integrated. And thank you very much for that work that you have put behind the Charter Agenda. And congratulations for the whole committee as well. It will be really taken into account in our work here at the Social Covenant. Thank you so much. You have made my day. It's much easier to integrate things when you have clear mandate from our politicians. Allow me now to go to a very dear colleague of ours, Abdallah Anati, Executive Director of the Association of Palestinian Local Authorities. We are very pleased to have you with us, dear friend. And we are very happy to be able to give you the floor and see you in good health and good spirits. Abdallah, the floor is yours.
Thank you, Emilia, and good morning, good evening for everyone, and many thanks for the team of the UCLG for your excellent and amazing work. Speaking on behalf of the Association of Palestinian Local Authorities, on behalf of more than 400 municipalities and village councils in Palestine, and from the everyday experience that the local governments in Palestine try to keep their communities well under a well-known pressure. The letter on public health asks whether we see health as a public good, a human right, and as a field where prevention and equity must be central. We agree on this, and from our local government perspective, we add a very important point. Health is also a collective political responsibility. The health status of our residents is not only shaped in hospitals and clinics, it is the end result of how territory manages water, sanitation, housing, public space, air quality, transportation, and so many other things. When these areas are neglected, the medical system, the health system, is asked to repair a damage that could be prevented. Many municipalities, including those who represent, do not run hospitals, but they are deeply involved in what public health experts call the social determination of health. The traditional description of local government works actually describes a core health function: reliable drinking water, safe streets, effective waste management, so many things. Do more to reduce diseases and early mortality than any individual treatment. When we talk about universal health coverage and primary care, we should recognize these basic municipal services as part of the same story, not as a separate one. The letter also calls for redefining health from ground up, and here our recent experience is very clear. As Palestinians, we are experts in this. In times of crisis, people run first to their municipalities and to their immediate community leaders. Local authorities coordinate shelters, water services, keeps public information flowing, and work alongside with volunteers, neighborhood communities, and civil society organizations. This is what community resilience looks like in practice. A democratic approach to health policy must therefore give these local actors the fiscal space, data, and decision-making authority to manage their own health systems and environments, instead of seeing them only as implementers of national plans. We also, as Palestinians and Palestinian local governments, welcome the reference in the covenant to caring and feminist approach. Municipal teams sees daily how the burden of care for children, elder persons, people with disabilities falls, unfortunately, on women, and how urban can either support or exhaust them. A social contract for health should include a commitment to neighborhoods where care is built into the physical fabric, safe public spaces, accessibility for primary services, good public transportation, and basic facilities like childcare, community centers, and so many other issues. This is not only a question of design, but it's also housing justice and local finance. If housing is overcrowded or insecure, and if municipalities lack the resources to invest in preventive infrastructure, the cost is immediately visible to the people's physical and mental health. Looking ahead to Tangier, our one message, especially from our side, and it's very important for us. If we agree that health is a public good and a shared responsibility, then local and regional governments need a stable place in global health governance. Today, most international debates on health take place between states and global institutions, while daily work of delivering health life happens in cities, towns, and rural communities. The local social covenant can help to close this gap by making it explicit that local voices should be part of the agenda setting, policy design, monitoring, and not only by implementation. Thank you very much.
Thank you very much, Abdallah. I think we are going to ask you for your inputs. They are already appearing in our mural, colleagues are making sure that everything is documented. But I think that the very strong link that you are making between that collective responsibility and that duty bearing that local governments have and the global agendas that are being developed without a seat at the table from this sphere of governments is extremely powerful. And thank you for connecting so many dots for us. Thank you as well for bringing the voices of the territories in Palestine to our discussions. And we look forward to seeing you and your team very soon in Barcelona during the retreat. I know many are hoping to see APLA active and well over here. So thank you, and allow me now to go to Emilia Koika-Lainen. The second part is difficult. The first part, obviously not, councillor. A city councillor of Keru and member of the delegation of the Association of Finnish Local and Regional Authorities in our governing bodies. Welcome, Emilia.
Thank you, Emilia. Yes, so hi everyone, and good evening from Finland, from the Finnish winter with -20 degrees. It's been an honor to hear all the other participants and the discussions, especially about the healthcare. Finland is the country of over 300 municipalities and 5.6 million people. But actually the healthcare, as a Nordic well-being county, of course, we have the system, state organized system for healthcare. The healthcare in Finland used to be in the responsibilities of the municipalities, but in 2023, there was a large reform where 21 well-being counties were established. And these well-being counties are democratic entities which have their own councils. I myself I'm also a councillor in the Central Finland well-being county. But when it comes to the healthcare system in Finland, I think these ideas of mine or the topics I will give you are quite practical. As you might have the impression that Finland has a good system for healthcare, we indeed do. But of course, we also are facing challenges. The declining and aging population, especially on the rural areas and outside of cities, is challenging the system itself. And we also are facing polarization of well-being, which of course is an important issue, as we all know that when healthcare is in crisis or whether it's not existing, there's also the risk always for internal security, or it puts challenges on internal security. But in Finland, healthcare systems and both municipal and regional authorities are also connected to this preparedness activities and preparedness responsibilities when we are also therefore connected to the preventive of crisis that might occur. And COVID was one test that put the system on, and of course many, as we all in our communities, we learned many lessons from it. But there were some of the key questions, like, is health a public good? And for certainly it is. And it is a human right, and the equal access, universal tax-funded healthcare in Finland is one of the key, or it's the foundation for our well-being country. And when it comes to the municipalities and the local authorities, we have a special assignment set. There's the preventive well-being that is in the focus, and this puts focus from the collective healthcare system onto individuals. Our municipalities have programs, we have specific tasks and targets for creating preventive well-being for our citizens. So the question is how to support and educate so that we individuals make good choices that support our health itself. And this might seem a bit of a stretch when it comes to healthcare, but of course it's profoundly connected with it. With all the preventive work, of course, the aim is to have better quality of life, but also secondary, it then eases the challenge that is set to our healthcare system and funding of it. So when we take care of ourselves, the healthcare is less needed. Of course, there are many cases where it's not a choice whether you get ill or not, but there are a lot of things that we can put an effect on, or where we can make the choices for ourselves and make the better choices. But these are also, it's a good point that we provide, for example, programs. Most of the municipalities have either a team or at least one person that coordinates this work. So the strategic targets, but also the operational work, how we work then with different sort of parts of the society and also in different sectors, and how we get connected with all, not just on all age groups, from children to grandparents, but also to that whether you have disabilities or not. But if you have disabilities, you also have the access. So that there is certainly equal access also to these well-being services that are good for you, whether it's just a fitness center that is locally organized or whether it's some sort of group work that is done with certain disabilities. So all sectors of our population is covered with this work. So this puts the Finland a bit on a different perspective as we talk about healthcare systems and local authorities. But for certainly, Finland and Finnish local organizations strongly support this strengthening of local and regional roles when building these healthcares as whole. And we, of course, are willing to support the global cooperation as a whole. Thank you.
Thank you very much, and thank you as well for bringing these aspects, these fine lines between that private sphere of individual decision making with the collective efforts that we need to make and collective responsibility. Right? It is very much what Co-President Rice was talking about. I mean, you need to work on the environmental and social frameworks, but you also need to build an understanding of what health means, what quality of life means. It is part of the challenge that we are accepting for our membership. So thank you very much for bringing that complexity as well to the table. We will need to reflect that and see how we put that through in the outcome documents dealing with this. And thank you for sharing the experience from Finland. And allow me now to go to Alejandra Bravo from the city of Toronto. Welcome, Councillor. Thank you for your patience. It's great to have you with us.
It's delightful to be here. Thank you for the invitation. I think this municipal movement shaping the conversations that are needed to uphold and promote human life and also the health of the planet in connection is really crucial. I want to just share from the Toronto perspective that our public health approach is very much focused on social determinants of health, which have been often mentioned in this conversation. That means reducing health inequalities and considering these in many different dimensions, including, of course, income inequality, which has exploded in Toronto and in Canada, and also thinking about the commitments and obligations that we have to Indigenous people through our reconciliation action work, and particularly focusing on people who are facing racialization and exclusion, and offering services to people who are undocumented as foundational to societal health and well-being. I really want to uplift what I've heard from others about the connections of this lens on health and other charter commitments that are being made in this movement. Particularly, I want to focus on housing and reinforce what others have said there. Our work is really, if we're going to start from security of the person, has to start with people having a roof over their head. And if you consider right now in Toronto, it's also about minus 15 degrees. And in the summer, we have very, very high heats and very threatening wildfires, smoke, etc. It's at the core of what we're doing, starting right now with preventing homelessness through supports to keep people housed when with the rent bank and other preventative measures involving monitoring landlords and forcing them to face their responsibilities. Providing shelter. We have the largest shelter system in Canada, and I would venture to say per capita the largest shelter system in North America. And then making sure that those transitions occur into permanent housing, which is, of course, our goal. We have a housing charter. Our commitment is to progressively realize the right to housing, and we've made some real strides in recent years in this administration. Right now in Toronto, the greatest number of housing starts or new housing builds at about 65% are actually incentivized, partnered with, or using public lands, municipal public lands for affordable housing. And we are growing our supply of supportive housing, because I think that one of the particular aspects of our challenges in terms of health has to do with food insecurity, as has been mentioned, but also mental health challenges spanning all age groups and incomes, but particularly impacting people who are facing more economic barriers. And so all of these things are tied together for us. I think that it's also been said, and I want to reinforce that taking action on housing, building housing, or improving housing stock is very tied to climate goals, because half of our emissions are from our carbon emissions are tied to buildings, and we can make a huge impact there in terms of thinking about a circular economy that actually creates workforce opportunities for people. And it's I believe been said by some of our colleagues here that transportation is also a huge emitter, and we have really allowed over time, from a national and regional perspective, a decline of transit in Toronto, but the municipal government has stepped up, like in so many other cities and in so many other ways, to fill the gap. We are making the largest investment in our very constrained municipal budget is in public transit, keeping transit fares low, expanding opportunities for people to purchase group fares, and also to increase service and ensure that the conditions for the workers and the riders are better and safer. I think that's also an important connector to employment, to study. So again, a part of the circular dimensions of this. And they're tied to our social development goals, which ultimately are not just to reduce poverty, but to make the transition to a more inclusive economy where every development activity, including in the private market, we put pressure to make sure that there are better outcomes, more affordable housing, even more affordable commercial, so that we can have neighborhood retail, access to food and food deserts. Pardon me. These things are being brought forward as part of the action plan for Toronto's economy. Of course, we're facing a lot of threats here around tariffs, and the very unstable neighbor to the south. But we see in this an opportunity to make sure that the economy being all of us, every neighborhood, and all of the activity that takes place, that we put equity at the center. And the transition that I'm certainly pushing for and that has been adopted by Council is to start talking about social and economic rights, which is not something that's common in Canada. And I think that while it might be very much in other parts of the world, and we have a lot to learn. Finally, I'll say that because I think I'm into my 5 minutes, that this idea of inclusive economic development and all of these things tied together, including the commitments that are being made in this movement, is really about re-examining what growth means and economic and health and well-being are. If we make equity the metric of growth and not an unsustainable economic model that has put us in a very precarious place, I think that we have a lot more to do. And of course, land use planning is a fundamental piece that municipalities have more control over and is the foundation and the bedrock for health and for every other goal that we've espoused together. Thanks for the opportunity, Emilia.
Thank you, Councillor. Thank you, Alejandra. Well, it's always a pleasure to listen to you, connecting all these dots that we have on the table. And I was recalling some of the intensive discussions that we had working towards the De Jong Congress in our Pact for the Future of Humanity, when considering whether we had to mention or not the need to reconsider whether GDP was the way that we were going to measure growth, and seeing this coming back at a moment where everyone is focusing so much in the traditional economy, and the big scale economy is really refreshing. And I truly see as well an opportunity in these difficult times when we are questioning some models that were dear to us, certainly, international law and multilateralism, etc. It is also an opportunity to rethink how we measure, how we define things. It is an opportunity. So also a way to look at proximity from a different perspective. It's not about only localizing, right? It's not about only looking locally, but it's rethinking proximity and how that relates to our global aspirations and the global citizenship that I feel we all deserve. So thank you for bringing this to the discussion, and I hope we are up to the task to reflect all of these and to put all of these in the outcome documents as we work towards the Congress. And talking about our pathway towards the Congress, Mexico is the next stop, Mexico City, and I'm very happy to have the representative of Mexico City with us, Rocío Lombera. Ya sabes que estamos casi allí, ya falta muy poquito, nos vamos a ver antes, estoy segura, pero ahí en México es cuando tenemos que mirar uno de los primeros borradores de este documento tan ambicioso que tiene que salir de este pacto. O sea que es un gusto tenerte con nosotras, Rocío, bienvenida.
¿Qué tal? Un saludo a todas y a todos. Gracias, Emilia. También un saludo a María Fernanda y a Alejandra y a todos los aquí presentes, pues que nos reunimos en esta reflexión colectiva que es muy importante respecto a tres asuntos que son necesidades humanas básicas y que como gobiernos locales pues tenemos que mirarlas en cierta perspectiva. Claro que estamos de acuerdo en que hay una crisis mundial de vivienda que afecta a miles de millones de personas y que eso pues nos lleva a pensar esta necesidad básica no como una mercancía. Yo creo que parte de esto es que es un problema estructural que está atrás del sistema neoliberal que coloca la vivienda como un activo financiero más que como un derecho humano y un bien social. Y esto ha ocasionado pues el encarecimiento de las viviendas en su adquisición, en la renta, desde el centro hasta las periferias, no solo en las áreas centrales, sino que eso se ha extendido y sobre todo ha encarecido la vida en general de las personas, de todos nosotros en nuestras ciudades y se refleja justamente pues en cada vez más movilizaciones y expresiones en dos líneas centrales que vemos, que es la gentrificación. En la ciudad hemos tenido ya movilizaciones importantes, ahora están actuando en relación con el problema de la gentrificación, que lamentablemente a veces se asocia también a la cuestión del turismo, pero pues digo, somos países abiertos a todo esto, pero sí se está generando también esta relación importante. Y por el otro lado, a la informalidad en la producción y en las transacciones respecto a la vivienda en renta, a la adquisición, a la tenencia de la vivienda. Y esto nos lleva como gobiernos locales pues también a ver qué hacemos frente a esto. Algo interesante que colocaste, Emilia, es esta frontera delicada entre lo privado y lo público y cómo vemos que estas necesidades individuales, teóricamente, pues realmente están produciendo problemas no solo individuales, sino problemáticas sociales y que tenemos que atender públicamente, porque se generan problemas públicos que ya asumimos los gobiernos como parte de esta responsabilidad de enfrentar estos problemas públicos que se fueron trasladando de lo privado a lo público y están generando en cadena más problemas públicos en otras áreas. Nosotros coincidimos con varios de los que aquí han estado, con Utrecht, por supuesto, y con la mayoría, que la vivienda es un derecho humano y un bien social de la sociedad humana que está soportada en bienes comunes fundamentales como es el suelo y como es el agua, ¿verdad? Sin esto las viviendas pues no podrían sobrevivir, pero además pues sí, es más que un servicio público, lo vemos como un bien público, y en este sentido también vemos que este bien público que corresponde a un derecho humano, el derecho a la vivienda, está conectado va más allá de la infraestructura en sí que pueda ser las paredes de una casa, a todo un ecosistema de hábitat que es la ciudad, y por lo tanto tenemos un vínculo muy importante entre el derecho a la vivienda adecuada con el derecho a la ciudad, que implica entonces la respuesta integrada, transversalizada de todas las áreas de gobierno prácticamente, y ahí entra por supuesto la salud, la seguridad, la violencia, la no violencia, la paz, entre otras cuestiones, ¿no? Nosotros en la ciudad estamos colocando digamos, este bien público y este problema público en un primer orden. No solo estamos comprometidos a nivel discursivo, sino a nivel activo en términos de una acción más directa frente a estas crisis de salud, de vivienda y de seguridad y paz. Nosotros trabajamos el concepto de construir la ciudad utopía, hacer realidad el derecho a la ciudad. Y en este sentido, en vivienda, por ejemplo, se ha creado una Secretaría de Vivienda que no existía, se ha duplicado el presupuesto de vivienda, hay una meta importante de producción de vivienda pública, retomar la producción pública de vivienda que no se perdió en la ciudad, estaba a nivel, digamos, nacional, pero no a nivel ciudad, y también tenemos tanto para adquisición de vivienda social como para renta también, para diversos sectores prioritarios como son los jóvenes, las madres solteras, las personas adultas mayores, básicamente mujeres, etcétera, para enfrentar esta desigualdad económica, social, territorial y de género, ¿verdad? Que es también uno de nuestros focos. En este sentido, se acaba de sacar hace unos meses el bando 1 frente al problema de la gentrificación que llamamos por una ciudad habitable y asequible con identidad y arraigo local, que tiene 14 medidas que estamos trabajando justamente para poder hacer asequible la vivienda a todos los sectores de la población. Y actuar frente a la gentrificación con medidas de no desalojos, o sea, cómo trabajamos con los desalojos que están a la orden del día por este problema de gentrificación. Y en este sentido también valorar que la dimensión territorial que se ha mencionado acá. Creo que tendríamos que tomar en cuenta esto que se dice para vivienda, salud, paz y seguridad, esta perspectiva territorial, este gobierno territorial que nosotros decimos somos gobierno de territorio y no de escritorio, conlleva la acción de estos derechos, de estos bienes sociales como una responsabilidad pública. En términos de la vivienda, más allá de esto que platiqué, está el proyecto de Utopías que ustedes conocen, que ahora ya se generó un órgano descentralizado para poder atender los servicios, infraestructuras en todo, más integrales.
30 segundos, Rocío.
Próximos, ¿sí? Y en este sentido tenemos las utopías. En términos de salud tenemos el programa Vida Plena, Corazón Contento, y en términos de paz y seguridad, Territorios de Paz e Igualdad, que son programas totalmente territoriales donde actúa el gobierno de manera integral. Por último, quisiera colocar pues que estamos también en este sentido, trabajando con la Carta Agenda de Derechos Humanos que levanta la voz y el protagonismo de las ciudades en estos temas, además de la alimentación y otras necesidades básicas, y que este debate global es indispensable y debemos exigirnos como ciudades, pues continuar profundizándolos para poder colocar agendas muy claras que realmente transformen la vida de la gente, y solicitar a CGLU que siga siendo este espacio como caja de resonancia de los planteamientos que aquí estamos trabajando entre todos. Así que muchísimas gracias por este espacio, y pues es como decimos nosotros, casa por casa, barrio por barrio, construimos la ciudad a diario y con nueva visión, nueva pedagogía y nueva ética pública.
Muchísimas gracias, Rocío. Casa por casa y nosotros aquí corazón por corazón. Así vamos haciendo agenda colectiva, vamos ganando espacio que yo espero que no sea solo caja de resonancia, que es ya muy importante, sino también bases para renovar la política pública. Y tenemos a Amanda, que ya ha compartido los enlaces para algunas de las cuestiones que ha sido presentando, el bando 1 y también el tema de vivienda. So everyone that needs to look at the details of what Mexico City is doing, you have the links over there. And now I am very happy to give the floor to Dionisio Michel Murinda. It's great to see you again, Councillor. She is a councillor from Yegu Rural District in Zimbabwe, and she's also the chairperson of the Zimbabwe Young Women Caucus. And we come across Dionisio many times as a champion of youth participation. We are very happy to have you with us, and I am very pleased to.
Thank you so much, ma'am. Salutations of the day to you all. I'm sorry, my lighting is a bit bad, I've noticed. Thank you so much, Chair of the meeting, and thanks so much as well to the UCLG for doing this critical dialogue at a moment of converging social, health, housing, and climate crisis. From my experience as a councillor working closely with rural communities, housing cannot be separated from health, justice, or social cohesion. When homes are unsafe, distant from services, or environmentally vulnerable, health systems are placed under strain long before people even reach a clinic. This is why public health must start where people live. I would like to begin with housing, because housing is where public policy becomes a lived reality. It is where health is either protected or undermined long before people encounter a health system. As the Housing Justice Letter reminds us, for 2.8 billion people worldwide, home has increasingly become a site of vulnerability rather than safety, shaped by discrimination, insecurity, environmental risk, and unaffordable cost. From the perspective of rural territories and small local governments, housing is not simply a sectorial issue, it is a foundational infrastructure for public health, gender equality, climate justice, and social cohesion. Inadequate housing conditions, overcrowding, unsafe construction, lack of water and sanitation, insecure tenure directly translates into preventable disease, mental health stress, and disproportionate care burdens carried by women and young people. This is why I strongly agree that health must be addressed as a public good and a fundamental human right. But to do so credibly, we must act upstream. Health cannot be protected if housing systems continue to reproduce exclusion, displacement, and environmental harm. In this sense, the housing crisis is also a public health crisis. I also fully agree that equal access to healthcare, universal health coverage, and strong primary and preventive healthcare systems are essential in rural and marginalized communities. Prevention is not optional. It is the most equitable and cost-effective approach. Yet, prevention does not begin in clinics. It begins in safe, affordable, and dignified homes in proximity to services, livelihoods, and social networks. And this brings me to the call to redefine public health democratically from the ground up, which I strongly support. Public health must be co-produced with communities, caregivers, and local actors. And this mirrors the Housing Justice Framework's call for housing to be radically democratic, recognizing community-led solutions, informal and social production of habitat, and local knowledge as assets rather than failures of the system. The 4 pillars of the housing justice provide a powerful policy lens for local governments. First, tracking discrimination, and that is stopping forced evictions, regulating land and rental markets, and addressing the specific housing needs of women, youth, persons with disabilities, migrants, and rural populations. Second, being radically democratic, and that is embedding participation in planning, supporting community-led housing initiatives, and recognizing that democratizing housing strengthens democracy itself. Third, building caring and sustainable cities and territories, using housing as a lever for climate justice, disaster risk reduction, and environmental sustainability, particularly in climate vulnerable areas. And fourth, unlocking a diverse and a fair future where through ethical, non-speculative housing finance and diverse tenure models that respond to changing social realities. These pillars align directly with the local social covenant, which calls for new social contracts grounded in care, equity, solidarity, and planetary responsibility. In this spirit, we all should fully commit to forging a new social contract for health, one that recognizes housing, climate, food systems, and care work as core determinants of well-being. Let's also commit to advocating for a stronger role for local governments in shaping these determinants. Local authorities are the first responders to crisis, yet they remain under-resourced and underrepresented in decision-making. And empowering local government is not decentralization alone, it is an investment in resilience. And finally, let's also strongly support embedding local voices in global health governance. Global agendas will only succeed if they reflect the lived realities of rural territories, small cities, women and young people, and not only large metropolitan centers. As we move towards the UCLG World Congress in Tangier, this conversation offers a real opportunity to reposition housing and public health as inseparable pillars of a just, democratic, and sustainable future designed from the ground up and led by local government. I thank you.
Thank you very much, Dionisio. It's always a pleasure to listen to you, and we are very grateful that we can bring the elected and the youth perspective, but also this very comprehensive vision of what local and regional governments need to bring to policy development at a local but also global level. So thank you very much for those reflections. I think it is important also to break the silos that we have around urban and rural, and looking at your experience as elected official from a rural district and making that connection with the broader agenda is really inspiring. Thank you very much, Dionisio, and certainly we are hoping to count with your voice and your determination in our Congress in Tangier. Thank you again. And allow me now to open the segment that is starting to wrap up this very rich conversation. And I want to do this with Billy Cobbett, our Ubuntu advisor. He was very involved in the drafting and the development of our Pact for the Future of Humanity for the young Congress that has been inspiring our work program since then, now 4 years ago. Billy, how do you see the conversation going? And I know we'll continue with these reflections as we go into the retreat and we start the drafting of the outcome document of Tangier. We still need to find the right title for that document, by the way. But how do you see the conversation going? What do you see new? What do you see confirmed? Any reflections from your side?
Sure, and as always, once again, kudos to UCLG for designing a new methodology. The letter exchange is a very interesting approach. I wanted to make 3 observations, Emilia, and not to open up a new conversation, because it's a very dangerous thing to do at the end. The first is that in so many countries, there is an asymmetry between the demands that we want local governments to make and the services we want them to provide, and their legal human resource capacity to be able to do that. Quite simply, many local governments are not in a position to articulate or effect the demands that we're saying that they should. And that should always be at the back of our minds, because there is a mismatch very often between what they wish they could do for their citizens and what they are authorized and able to do. That's the first point. The second is, I would hope that we would augment the language of human rights, which is front and center and correctly, but also allow us to make arguments about, for example, the efficiency of these kinds of approaches, that they are more environmentally and socially, economically efficient to have these kinds of approaches. And it's not just a question of justice, but you can make a compelling case as to why this kind of approach actually makes, and it's not a terrible thing, economic or social or political sense, and not just a moral argument, as important that is. And the third is, and this is maybe in the design of the exchange of letters, but when I read, for example, the housing letter, I found the tone, it read a little bit like an end of school report from the headmaster telling the children that they've really got to do much, much better. I don't know if this is intended as provocative, but in part, some of the things that were proposed, so it looks a little bit like a lecture, and possibly a bit patronizing. And I'm not sure that you're going to get a positive response when you're told that you're not behaving very well and you need to improve your performance at school. And so go away and phone us when you're finished. So, but apart from that, very rich and very welcome. Thank you, Emilia.
Thank you very much. Yeah, we are always struggling with these things in tone and asymmetries. Thank you very much for those reflections. We'll take this into account when in this new phase that is starting to bring the different visions together. And my hope is that the movement, the collective that we represent, is willing to accept in the structural dialogue with civil society those things that are expected from them, but that we also bring back those ideas that are inspiring the day-to-day work of local governments. And in that balance, that's the type of balance that we need to find. And it's one of the reasons also why we are still struggling with how we are going to call this outcome document, beyond outcome document. Is it a charter? No. Is it, we need to think about it, but it's very connected to what you're saying. And also in terms of symmetries, I very much agree with that. But it has put me at ease to see in the diversity of voices that we have seen today. There is a lot of symmetry in some of the solutions that they are identifying, even if they are only narrative. So I don't know. I'll stick to that, but some thinking that we need to do indeed. I want to invite, I don't know, it's a colleague from the world. Yes, Natalie, I see you. I'm going to you for some quick remarks. Then I'm going to invite Maria Fernanda Espinosa, our other Ubuntu advisor, to reflect with us as well. If you are ready and willing, of course, Maria Fernanda. And then I would also like to go to Luisa, and we will start to wrap up this incredible afternoon. So Natalie, some thoughts from your side.
Thank you very much, Emilia. And colleagues, you made my day. I mean, finishing a day like this is, extremely rewarding. And it's very humbling because, listening to all the work that is happening out there. So a very few reactions because I know that we are running out of time. But maybe just the first one is, again, to reiterate from a health perspective how interlinked the three domains that we have been addressing today are. And I understand that we need to look them as such one by one, right? Because there is also an added value of doing this for multiple reasons. But there is also this incredible value of seeing how housing and health, right, understanding that health needs to go through proper, adequate and safe housing infrastructure. The second item that I want to put on the agenda is the issue that we discussed about inequalities. And again, when we look at public health, we are facing more and more inequalities within actually cities, within local communities. It's not anymore between countries. It's actually within, very local context. But that's also where we can actually act the best, because that's where knowledge exists. Because actually we know what works. We know actually what partners need to be implemented. So a challenge can actually become, a strength. And then I think my last point is about what has been repeated, I think, during discussion, is this knowledge of co-production. And when I say co-production is twofolded. Co-production of global agenda through local, communities, through municipalities, in order to make sure that the voices are heard. And then co-production, and again, I'm speaking from a public health perspective, from local communities for the agenda itself, being sure that the most affected ones, but also all the players, not only governmental institutions, but non-governmental institutions are part of decision-making process. So this co-production, approach is for me absolutely crucial at various levels. So these are just some, reflections from my end. And again, thank you so much. This was extremely interesting. Thank you very much.
Thank you very much, Natalie. We will take this into account. We like co-creation and co-production. Certainly, it has its challenges and limitations, but we certainly feel that this is the way to go, and we will need to adapt our governance structures to some of those processes as well. So, thank you for bringing this to the discussion. I'm going to Maria Fernanda Espinosa now. Maria Fernanda, we have seen each other not so long ago, a wonderful couple of days in Madrid with women leadership organized by GWL Voices, pushing for feminism, for a strong multilateralism. And I am just wondering, I think there are many connections between this conversation and some of the conversations that we were having in Madrid. So I'm very pleased to have you with us, wearing your Ubuntu hat, but all the others as well. Thank you for being with us.
Well, thank you, Emilia. And it's so exciting. There is so much wealth, intellectual and political wealth in what we heard, and I see that there is a challenge even on how to name this collective exercise and co-creation, and I think that is going to be among the main challenges. And perhaps of what I heard and I learned today, 3 very quick reactions on. I was thinking, how is that we weave some common sense, not only with that, but with the food systems, the climate discussions, the new essentials. What are the big, the grand ideas that put this covenant together, this new social pact together? I can think about three issues that were inspiring from what we heard. One is the issue of interconnectedness and a multi-level approach to this. And of course, UCLG is an expert in connecting what is happening at the global level, where we see regression and pushback in so many of these things. But at the local level, we see a capacity of reinvention, reasserting rights and services. So that is one issue. And of course, the issue of strengthening access, democratization of rights, and rights over privilege. I think that was a weaving, a common idea that went through the 3 issues that we discussed today. The second issue is about, which is part of the new essentials, but to use caring societies and caring economies and care economies as also framing the rest of the thematic entry points that we saw. Several of you spoke about the structural drivers, the interconnectedness, but I think caring societies and caring economies is also part of this big umbrella that I see as a common thread. And the number 3 is the idea of this social, institutional, and physical infrastructure as scaffolds to sustain governance and commons at the same time. And I think it's also important to say, what are these scaffolds that bring societies and cities together? No, and that goes from strong institutions, a strong social contract, but also a strong physical infrastructure. And this has to do a lot with what Billy mentioned about the issue of performance of our local democracies and local governance, the issue of impact and performance, because that's what brings, at the end of the day, legitimacy. In just perhaps a footnote on the part of conflicts and the security, the peace and security approach, I fully agree with the idea of prevention and of course look at the root causes and the underlying and structural drivers of conflict, which is exclusion, discrimination, and inequalities. But I think that everything I said has to bring in what characterizes UCLG, which is the feminist lens to all of this. This is extremely important. Every single issue that we discuss, the issue of housing, we know that there are highest numbers of homelessness in women. If we discuss the issue of conflict and violence, we know, and I disagree a little bit saying that we have made great strides on violence in cities and cities for peace and all of that. Unfortunately, we have seen, gender-based violence and femicides increase in the past years, and we need to be very strong on this issue. So I say, please, let's use these feminist entry points, because this is one of the parts of the DNA of this municipal movement. So that said, very inspired as always, and very encouraged to what is to come and how to continue shaping this covenant, this charter, this co-creation of a new era of a municipal movement that is up to the task in the world we live in today, which is a little dire, I have to say.
Thank you very much, Maria Fernanda. And I was so grateful when Abdallah brought the feminist perspective to everything, and coming from Palestine. That was so very powerful. But you are absolutely right. Sometimes when we have these concepts that are, transversal and mainstream in everything we do, it gets lost a little bit. And so we need to find a way to ensure that this is very clear in what we propose. That this social covenant is clear about that feminist lens and that care lens as well. So thank you very much. And it is true that as no other movement right now, we are calling for housing to be acknowledged as a crisis. But also violence against women needs to be very much acknowledged as a crisis, and that is not done sufficiently. And so, point taken. Thank you so much for that, Luisa. You are going to have the final remarks from this excellent afternoon. The floor to you, dear friend.
Thank you. What an honor. And I will try to keep it short because I know we are over time, but I just want to thank everyone for their excellent reflections. I know that it sure gave us at PCRCs a lot to think about and reflect and to be inspired. I'm particularly happy to hear about the great work that our cities are doing with youth to prevent violence. Preventing violence is all about breaking those cycles. And it really starts by investing in our young people and giving them chances to have a fulfilling personal, professional, and social development. So that's really great to hear. Also about the work that it's doing with civil society. As I mentioned, preventing violence is a matter of whole of government and whole of society. So we can't do this only through governments. We have to do this with individuals, with civil society, and with all levels of government. So that's great to hear. I also love to hear about the connections between violence and the social determinants of health. Violence is a social determinant of health, and more than that, violence is a public health crisis. It is shortening lifespans. It's leaving people injured and unable to rejoin society. And the way to prevent violence, it's very much the same way that you prevent all diseases, is about understanding what's causing it, understanding the root causes of violence, addressing it, and trying to prevent its spread by focusing on the areas most at risk. So all of that's great to hear. Also, the connections with housing. Housing is definitely a root cause of unhoused is definitely a root cause of violence. So that's also really important. And just want to close by emphasizing the feminist lens. Gender-based violence is absolutely a silent crisis all around the world that we need cities to address. Also, not only that, but also the ways the masculinities are built and portrayed in society are also cause of violence, and something that we have to think of how to build healthy masculinities that do not put women and people with other gender identities in risk. So thank you very much. It was a pleasure being here, and I look forward to continuing engaging with the UCLG community.
Thank you very much. Thank you for your engagement. Thank you, everybody, for having joined us today, to the diehards that have been with us until the very end. We know these are long sessions, but we need all of your voices, all of your visions to build our collective agenda. And I think as team, we are energized. We feel we are on the right path to build something solid for the movement. And again, we will do our best to make sure that all of your visions become the visions of our movement as a whole. Thank you from Rwanda to Palestine, to Mexico, Madrid, and Brussels, anywhere you are. Thank you all. Thank you very much. Keep well, keep inspired, and keep helping us building the movement. Thank you, everyone. Bye.